Good syndrome is a rare immunodeficiency disorder characterized by the coexistence of a thymoma, a tumor of the thymus gland, and low levels of immunoglobulins, particularly IgG, IgA, and IgM. It typically occurs in middle-aged to older adults, with a median age of 50 to 60 years, and does not favor any gender. Pathophysiologically, Good syndrome involves both B-cell and T-cell deficiencies, making patients highly susceptible to infections and autoimmune diseases. Recurrent infections are common, including bacterial, viral, and fungal types. Patients often experience severe sinopulmonary infections caused by bacteria like Streptococcus pneumoniae and Haemophilus influenza, viral infections such as CMV and HSV, and fungal infections like Candida and Pneumocystis jirovecii. Beyond infections, thymomas can cause symptoms like chest pain, cough, and dyspnea, although they are frequently asymptomatic and found incidentally on imaging. Autoimmune manifestations are also prominent, with conditions like autoimmune hemolytic anemia and pure red cell aplasia being commonly observed. Diagnosing Good syndrome requires a thorough clinical evaluation, particularly in patients presenting with thymoma and recurrent infections. Key diagnostic tests include measuring immunoglobulin levels, which typically show marked reductions in IgG, IgA, and IgM, and lymphocyte subset analysis revealing reduced B cells and abnormal T cell function. Imaging, particularly a chest CT scan, is essential to identify and assess the thymoma. The differential diagnosis of Good syndrome includes conditions like common variable immunodeficiency, which lacks thymoma, and X-linked agammaglobulinemia, which presents primarily in males during childhood. Another consideration is thymoma-associated myasthenia gravis, characterized more by muscle weakness than immunodeficiency. Management of Good syndrome focuses on the treatment of the thymoma, usually with surgical resection and possibly radiation or chemotherapy for malignant cases. Immunoglobulin replacement therapy is a cornerstone of managing the immune deficiency, helping reduce infection frequency. Additionally, prompt treatment of infections and tailored management of autoimmune complications are critical components of care. The prognosis of Good syndrome depends on the severity of infections and autoimmune conditions, as well as the response to thymoma treatment. Lifelong monitoring and multidisciplinary management are essential. For medical students, it's important to recognize Good syndrome in patients with recurrent infections and a history of thymoma, as early identification and appropriate management can significantly impact patient outcomes. Always consider an immune evaluation in adults presenting with these features to ensure timely diagnosis and intervention.